All right, well, there is a long list of birth control methods in today's Women's Care Wednesday. Dr. Jenna Harrison, an OBGYN physician with Women's Care Florida, is here to explain why IUDs are one of the most effective choices, and might I even say one of maybe the more popular choices these days. Good morning, doctor. Glad to have you here.
Good morning. Thank you for having me.
So let's talk about this. Let's talk about birth control, and because I do think there is quite a variety now these days. We are going to be diving into the IUD today, but talk about the different types that you're talking about with your patients these days.
Right. Besides IUD, there's birth control pills, or OCPs, are the common acronym for that, as well as the Nexplanon, or the implant that goes in the arm. You know, there's always the tried and true condoms, as well as other barrier methods like the vaginal diaphragm, as well as the depot shot.
Okay. IUDs, though, I mean, I feel like amongst kind of my circles, and I'm talking, I feel like you hear about these a little bit more. Are you seeing this in the office where these are becoming more popular?
Absolutely, absolutely. Only because it takes out the human error. So once they're put in, they're working right away, and they stay working until they're removed. So you don't have to remember to take a pill or come in on time for a shot. Or, you know, when you're caught up in the moment, you're already protected against pregnancy.
How do you explain what an IUD, for those maybe who are watching this morning and have not heard of an IUD, kind of explain a little bit what it is, what it's doing?
I always explain that it's a little T-shaped plastic device that goes into your uterus that we just put in the office, like when you would get your pap smear. Okay, and then it's, you know, a little bit crampy, a little bit painful, but overall, most patients tolerate it very well. It takes less than 5 minutes to put in, even if you haven't had a baby before. It's easy to get in.
Talk about the effectiveness, because we talked about that human error element that maybe, you know, comes with the pill or something like that. Talk about the effectiveness, and it seems like that is why so many people are looking to this more, and it is becoming popular because it seems like the rates are pretty successful.
It is extremely successful. It's over 99% effective. The failure rate is less than 0.1%. So it's extremely rare that people become pregnant while on the Mirena, pending that it was placed in the correct location.
And is there different types of IUDs as well? I mean, you mentioned the Mirena. I mean...
Yes, there is the copper IUD, which is Paragard, which is a great non-hormonal option for some patients who can't have hormones for certain medical conditions, or who just choose that they would not like to have any hormones in their body. Otherwise, there's different brand names of the levonorgestrel IUDs, such as Mirena, Liletta, Kylena, Skyla. Okay.
You mentioned briefly, too, kind of the process of actually putting it in. I mean, anything else that you would want, you know, patients to realize or know? I mean, it's a fairly quick procedure, correct?
Yes.
In office?
It's in the office. People are trained to put them in, you know, physicians, nurse practitioners, PAs, midwives, they've all been trained to do it. And, you know, most of the time we do it under ultrasound guidance right at the end, just to make sure that it's in the right place, so that when you walk out of the office, you have that tried and true confidence that my birth control is in place. I don't have to worry that it's somewhere else, because those are the stories that we all read on the internet of, you know, my IUD was found in my belly somewhere and they had to go get it.
Okay. Any other side effects or anything that people should know that you think is worth telling?
There's very few side effects, because most of the effects of the IUD are working locally inside of your uterus, which is great, because a lot of people have a lot of issues with hormones, especially birth control pills. You know, they can get nauseous or have headaches, things like that. The IUDs have very few side effects, most commonly maybe some acne, just because that progesterone effect isn't really taking place to help cover that up that the birth control pill would.
Okay. Well, again, the best thing, don't go to the internet and just start Googling. I'd imagine you want to see your doctor to see if this would be a good option for you, correct?
Absolutely, absolutely. You can schedule a consult at any time. Some even family practice physicians put them in. But if they don't, they definitely can get you to a OBGYN in the area who is happy to help and talk about all of your options with you, including IUDs.
Well, this is why I love the team at Women's Care Florida, because always educating us on these things. Thank you so much for taking some time with us this morning, and we'll put all the info on our website as well.